to Trust for America's Health's Age-Friendly Public Health Systems, or AFPHS, monthly training series. We're happy you're here to join us today and to learn more about how the public health sector can support older adult health and well-being. My name is Megan Wolf, and I'm joined today by my colleague, Dr. Karan Phillips. The AFPHS movement would not be possible without the generous support from and partnership with the John A. Hartford Foundation. Next slide, please. So I just want to remind everyone, please, to keep yourselves on mute during the presentations. We invite you to put your questions in the chat throughout the presentation today, and we will capture them and submit them to our speakers at the end for a discussion. And next slide, please. As most of you know, if you've joined us before, TIFA is a public health policy research and advocacy organization dedicated to optimal health and well-being for every person and individual. The AFPHS movement was developed to elevate healthy aging to a core function of state and local public health departments. We're joined in this effort by numerous national stakeholders, and we collaborate closely with representatives of other age-friendly ecosystem partners. Our AFPHS 6 C's framework is a strategic tool to advance that vision among older adults in our communities. Today, we'll be focusing on connecting and convening using the context of fall prevention work presented by our colleagues at the CDC to explore public health roles in healthy aging. So today, we are joined by Daniel Thompson with the CDC Foundation, and he will be joined by 3 of our partners from CDC's Division of Injury Prevention, Dr. Yara Haddad, Bailey Collette, and we will start with Dr. Gwen Bergen from the Division of Injury Prevention. So I will turn it over now to you, Gwen, and we look forward to your presentations today. Thank you so much for being here.
Thanks so much for inviting us to speak. We're going to talk today about connecting and convening partners to keep older adults injury-free and how CDC does that. Next slide, please. Our agenda is I'm going to talk a little bit about coordinating integrated fall prevention just as an intro. Then Yara Haddad will go over the clinical resources we provide. And Yara and Daniel will go over some of the older adult and caregiver resources we provide also. Then Bailey will finish up with our state, local, and tribal health resources. And we'll finish with a couple of case studies to show how these resources have been used by state and local health departments to coordinate and complement to provide comprehensive older adult fall prevention.
Gwen, there you go. Sorry, I was going to say you're on mute.
I wanted to start out with some data because we are the CDC and we always have to talk about data. Older adult falls are very common, as I think many of you know. Each year, older adults report 37 million falls. And just as a note, as for older adults, we consider ages 65 and up to be older adults. These 37 million falls result in 9 million injuries that either restrict the older adults' activities for at least a day or cause them to seek medical attention. And these injuries lead to 3 million ED visits each year, emergency department visits, 1 million hospitalizations, and most unfortunately, 39,000 deaths annually. Next slide, please. These older adult falls are also very costly. In 2015, we estimated that they cost the U.S. healthcare system $50 billion every year. This is just in medical cost. And the publicly funded payers, Medicare and Medicaid, that are funded by taxes, pay 3/4 of that cost. Next slide. The good news, though, is that many of these older adult falls are preventable. We look at both non-modifiable risk factors for falls and modifiable risk factors. Non-modifiable risk factors are things like age, sex, race, ethnicity, and whether or not you've already had a fall. These are things that can't be changed, but we can use these risk factors to target what groups might be most at need of fall prevention. I will also say in some cases, these non-modifiable risk factors, actually there is There are social, economic, maybe cultural factors underlying these, and that these really are not non-modifiable. For example, with age, we do lose muscle strength, and you can see that's a modifiable risk factor, but that is something that even as you get older, as you move from 65 to into your 70s and 80s, you can actually address that decline in muscle strength by doing physical activity and exercise. The modifiable risk factors here are like gait strength and balance deficits that increase your fall risk, along with medications that have side effects that make you more likely to fall. Home hazards can increase your fall risk. Orthostatic hypotension means that when you stand up suddenly from either a prone or a sitting position, that you have a large drop in your blood pressure, and that can make you dizzy and cause you to fall. Vision and foot issues can also cause you to fall, as can vitamin D deficiency, and a lot of comorbidities. For example, depression and arthritis can make you more likely to fall. The good news is each one of these modifiable risk factors has an evidence-based strategy that can help older adults reduce that risk and reduce their risk of falling. And Yara is going to talk more about those strategies. Next slide, please. So I wanted to talk a little bit about how CDC provides resources so that state and local health departments and public health systems can prevent older adult falls. They can coordinate all of this to prevent older adult falls. Next slide. And where we fit into the 6 C's framework is we fit in a lot of places. First of all, we are constantly collecting, analyzing, and translating relevant data on older adult falls, and providing assistance to state and local health departments in how to use data. We communicate important public health information and try to complement existing health promoting programs. And one way I do want to mention, we work with partners, especially with the Administration for Community Living and the National Council on Aging. We work more in the clinical space for older adult fall prevention, and they work in the community space. And we try to coordinate so that we are not duplicating efforts, as we do have limited resources for older adult fall prevention. We want to make sure that happens. So the 2 main places we really are working is in connecting and convening multi-sector stakeholders, and we are working across clinical, community, public health, older adults, and their caregivers, and trying to connect these to create effective strategies to reduce older adult fall risk. We do some coordinating of existing supports and services to try to support health departments and public health systems. We don't do as much in creating and leading policy systems and environmental changes. As a federal government organization, we are not supposed to advocate for policy. We do provide resources to organizations that can do that in terms of providing data and, again, tools for doing fall prevention. Next slide, please. So our specific older adult fall prevention goals at CDC are to make fall prevention a routine part of clinical practice, so that every older adult gets screened and if they're at risk, assessed at least annually for fall risk. We educate older adults and caregivers on how to prevent falls and fall injuries, as we've learned that many of them do not understand the most effective evidence-based strategies to reduce their fall risk. And finally, our newest goal is to provide technical assistance on fall prevention for state and local health departments and tribes. Next slide, please. And at this point, I'm turning it over to Yara Haddad.
Great, thank you, Gwen. I'll be covering Steady's clinical resources that are available through CDC. Next slide, please. We know that falls may not be a health priority for many older adults. In fact, less than half of older adults who fall talk to their doctors about their fall. And this may be to a belief that falls are a normal part of aging, or fearing that they may lose their independence if they reported a fall, or not being aware of the common fall risk factors that increase their risk of a fall. Since there's hesitancy from the patient perspective, the conversation about falls can be initiated by healthcare providers, and I'll go over some of our resources next. Next slide, please. The STEADY initiative, or the Stopping Elderly Accident and Deaths and Injuries initiative, was developed by CDC and offers tools and resources to help healthcare providers with their clinical fall prevention efforts. To screen for fall risk, assess for modifiable fall risk factors, and intervene using effective clinical and community fall prevention strategies. Next slide, please. The Coordinated Care Plan to Prevent Older Adult Falls provides practical steps to implement a fall prevention program based on STEADY into outpatient clinical practice. This could be done by using existing incentives to screen and assess for fall risk, such as during a Welcome to Medicare or annual wellness visit, and then adapting fall prevention tools to fit into the clinical workflow. So how to intervene based on the risks, like referring to physical therapy or occupational therapy if those risk factors are. Next slide. Great. So step one of STEADY is to screen for fall risk. The recommendation is to screen all older adults ages 65 and older at least once a year, or anytime they present with a fall concern. STEADY offers 2 validated screening tools, which include the 3 key questions and the Stay Independent screener. Next slide, please. For the 3 key questions, healthcare providers can ask their patients if they've fallen in the past year, if they feel unsteady when walking or standing, or if they have a fear of falling. A yes to any of these questions indicates that the older adult is at risk for a future fall, and additional risk factor assessments are recommended. If they answer no to all 3 questions, then the recommendation is to repeat screening in a year and then recommend general strategies to maintain health. Next slide. The second tool is the Stay Independent screener, which is a 12-item questionnaire that can be self-administered. If the older adult scores 4 or more, or they score less than 4, but also report a fall in the past year, that indicates that they are at risk of a future fall. And the recommendation is to conduct a comprehensive fall risk assessment and intervene as needed based on these findings. If they score less than 4 and there's no fall reported in the past year, then they can be rescreened again in a year and recommended for general health maintenance strategies. Next slide. Okay, for older adults that do screen at fall for risk, if comprehensive fall risk assessment is recommended. And the next few slides cover steps 2 and 3 of the STEADY steps, so the assess and intervene. I'll start with gait strength and balance concerns. The assessments can be done using tests for gait and balance, such as the timed up and go, or the 30-second chair stand, or the 4-stage balance test. Our STEADY webpage includes a handout and a video on how to conduct each of these tests that the providers can use. If the tests indicate there is a concern with gait, strength, and balance, then the intervention can be referral to physical therapy for targeted exercises, or a referral to a community-based fall prevention program like Tai Chi. Next slide. Another risk factor is medication use. The assessment here is to conduct a comprehensive medication review to identify any medications that may increase fall risk. Interventions here include working with the doctor and pharmacist to stop medications or switch to safer alternatives when possible, or reducing to the lowest effective dose of the medication if there is not an alternative. Resources for medication management on our webpage include our fact sheets, medications linked to falls, and the Safe Medication Review Framework, and Steady RX, which introduces implementation of Steady in community pharmacies. Next slide. Home hazards are another modifiable risk factors. Assessments here include checking for safety around the home, and we have a resource called this Check for Safety brochure that highlights some of these hazards. For example, throw rugs in the home, dim lighting, clutter on the floor, or stairs with no handrails. Excuse me. For the interventions, excuse me. Providers can refer to occupational therapy for a thorough home visit and assessment, or recommending safety measures, so actions that the patient and their caregiver can take on their own, like installing handrails on the stairs or removing the throw rugs. Next slide. Okay, next we have comorbidities. As we discussed, early certain disease states can increase the risk of falls, such as depression, dementia, incontinence. And the intervention here is to optimize treatments as needed and control the disease as much as possible. Next slide. 1 second, I'm sorry about this. Thank you. Okay, for vision disturbances, the assessment can be asking about vision changes or conducting a visual acuity test. Inquiring about use of bifocals is also important when they're walking outdoors, as that may cause issues with depth perception and increased falls. The recommendation are to use single distance lenses for walking outside, and providers can refer to ophthalmology or optometry depending on their findings. Next slide. For feet and footwear, the assessment includes for checking for foot deformities or changes in sensation or pain, and then assessing for improper footwear like flip-flops or high heels. Those can increase risk of falls. Interventions can include referral to podiatry when needed, or education about proper footwear. Next slide. Okay, the fourth step of study after the patient has been screened, assessed, and recommended for intervention is to follow up within 30 to 90 days. This ensures that we can review the plan of care with the patient and assess adherence to the interventions and discuss and address any barriers to adherence. For example, after being referred to physical therapy, did they actually receive the care, or did they have issues with transportation or cost and could not attend physical therapy sessions? So those are important factors to consider, because if they didn't receive the intervention, there's no added benefit to just screening and assessing. So the intervention is very important in reducing the risk. Next slide. On our study webpage, there are also resources specific for older adults and their caregivers. This is one example of what you can do to prevent falls brochure, which has 4 steps that older adults can take to address their risk for falls, including initiating the conversation with their healthcare providers. Brochures are available online to download and print for free. Next slide. Other patient or public-facing brochures include the Stay Independent brochure, which I mentioned earlier has a 12-item questionnaire, and then steps to remain independent. The Check for Safety brochure, which can be used to assess for fall hazards around the home. The Postural Hypotension brochure, which explains what orthostatic hypotension is and ways to try to minimize that effect. And then there are brochures specific for caregivers and older adults. Next slide, please. Some of our other material for patients include targeted exercises like the chair rise exercise that can help strengthen muscles and improve balance to reduce falls. All of these resources, again, can be found on our webpage to download and print. Next slide, please. Part of our continued effort to promote fall prevention is expanding our messaging to reach older adults and their caregivers. So as I mentioned, we have multiple resources specific to older adults, but the next few slides will go over additional efforts to raise awareness among older adults and their caregivers about falls and risk factors for falls. Next slide, please. Okay, in 2021, CDC launched the Still Going Strong communications campaign, which aimed to promote awareness of risk of injury among older adults and steps they can take to remain independent and age without injury. The campaign was launched nationwide with focused messaging in certain markets that had higher injury burden or higher proportion of the population that were older adults. The campaign included advertisement in the form of print ads, social media posts, video ads, radio ads, as well as animated GIFs or GIFs on web pages that are frequented by older adults like AARP. The primary audience of the campaign was older adults, but we also had materials for caregivers and healthcare providers as well. This is a screenshot of the Still Going Strong campaign webpage that is accessible through CDC. The main message of the campaign is that taking simple steps like staying active can help reduce your risk of a fall or injury, and it portrayed older adults engage in activities they've enjoyed throughout their life to maintain their health. Next slide, please. So in the green, you'll see an example of a print ad where the individual has enjoyed running as a sport. So you'll see him as a youth in the background, and then currently as an older adult, continuing to stay active to remain healthy and independent. Now, the campaign launched in 2021, May 2021, and after about a year after it was launched, we conducted an evaluation on how relatable and likable the campaign appeared. And then from the feedback we received, we worked to update the campaign to include content on social connectedness or maintaining connections with family and friends as we age, and including more diverse populations like tribal populations and older adults with differing physical abilities. The new assets that were produced this year can now also be found on our Still Going Strong webpage. And then on the next slide, we will share the new video ad with you that promotes staying active and socially connected to age without injury.
There is health in togetherness. Staying active and connected to friends and family keeps you on your game and still going strong. Learn how at cdc.gov/stillgoingstrong.
Perfect. And
Health
next
in
slide.
together.
I'll turn it over to Daniel at this point. Thank you.
Hey, everybody. Good afternoon. Daniel Thompson with the CDC Foundation, and I have been working on the Older Adult Falls Prevention Project with Division of Injury Prevention for the last 2 years. And I'm going to show you even more information about how we have been developing screening tools and a little bit about a fall prevention planning tool that's under development. So you've heard from Yara about the steady paper-based screener that is available to download and print for free on the CDC website. Well, this is the Falls Free Checkup, and it is available on the NCOA website. It's a screening tool that has been developed to help us educate older adults and caregivers about their risk factor for fall prevention. It was created by the CDC Foundation with technical assistance from CDC and NORC at the University of Chicago. And the link is there on the page, and you can just Google Falls Free Checkup and find the Falls Free Checkup there at NCOA. It is online, obviously, and interactive and adapted from the steady paper-based screening tool. It is free at the point of demand. There is no account required to sign up, no sign up required or anything required to use it. And it only takes about 5 minutes to complete the 12 yes or no questions. Next slide, please. So the Falls Free Checkup produces 2 results for the user, a normal risk result or high risk result for a fall. The results page you see here is for high risk, and we worked with NCOA to produce a video that walks the user through what the results mean. The page also contains information about how to reduce the risk for a fall and tips for talking with the healthcare provider. It contains the ability for NCOA to send a reminder to the user to then remind them to schedule an appointment with their healthcare provider to talk about the results and a report of the results for the user to save and take with them to their next appointment. Currently in development and slated for release in 2024 is the Living Injury-Free from Falls Every Day Fall Prevention Planning Tool. It is going to live along with the other fall prevention resources on the CDC website, and it will strive to educate older adults and caregivers about modifiable fall risk factors and provide evidence-based interventions for reducing that risk. The tool is planned to contain the ability for users to create their own fall prevention plan and be able to save and/or print that plan. So we are looking forward to that launch in 2024. Next slide, please. So just a little bit about our partnerships for older adult fall prevention. This is a list of some of the partners that we have engaged in the development of the Falls Free Checkup and the Life Tool. In the last 2 years, we have hosted several webinars and small groups or thought council presentations to update this group on the progress of the tools and solicit feedback on their development. As American Indian Alaska Native have among the highest prevalence of reported falls, we have made a concerted effort to form partnerships with several groups who represent AIAN health interests. And now I will turn the floor over to Bailey Collette to talk about state, local, and tribal health resources. Bailey?
Thank you, Daniel. Next slide, please. All right, I'm going to talk a bit about CDC's work to support state, local, and tribal health resources that promote fall prevention. Next slide, please. So CDC has partnered with the Association of State and Territorial Health Officials, or ASTHO, to conduct an environmental scan of state health departments and the fall prevention activities that they conduct. From this work, they've produced a best practice guide for state health departments on how to best facilitate community clinical linkages that promote fall prevention. This best practice guide is actually available now on ASTHO's website or through this link here in the slides, which we will be sharing afterwards. CDC actually plans to fund ASTHO in the coming months to work with 2 states and actually implement and evaluate some clinical community fall prevention strategies. Next slide. Additionally, CDC has a partnership with the National Association of County and City Health Officials, and this has resulted in multiple resources, including a guide to help local health departments develop the capacity to support clinical older adult fall prevention efforts. This guide can be downloaded from this link here, and it's also available on NACCHO's website. Next slide. There's also been some work to study the extent of the integration of fall prevention practices among tribal healthcare facilities, such as into clinical practice, data collection efforts, and other clinical survey services. We've conducted a survey of 94 individuals representing 27 tribal health facilities and found that persons associated with the Indian Health Service and tribal and urban Indian healthcare facilities do conduct some older adult fall prevention, but often lack awareness of steady resources. Perhaps most importantly, though, they have expressed a need and a willingness to learn more about fall prevention. Next slide. Finally, CDC is funding 2 tribes to implement steady core elements into their clinical settings, as well as to facilitate culturally relevant community-based programs for fall prevention, such as Tai Chi, community-based support for steady elements like screenings in community settings, and community clinical linkages such as referral and data systems. Next slide. Oh, sorry, I made a mistake there. Back to the previous slide. This funding will also further develop healthcare provider competency and steady-based fall prevention practices, as well as caregiver and tribal knowledge, competency, and participation in evidence-based and culturally adapted community fall prevention. Now we can go to the next slide. All right, now I'm going to discuss a couple case studies that showcase how the pieces that we've discussed today come together to complement one another and to provide comprehensive older adult fall prevention. Next slide. First, in Broome County, New York, CDC funded the New York State Department of Health Bureau of Occupational Health and Injury Prevention to implement study-based fall prevention. The New York Department of Health had identified Broome County as a site with community fall preventions in place that providers could refer out to, a high rate of older adult falls, and a fall prevention champion through the United Health Services. So these three groups, the New York Department of Health, the Broome County Health Department, and United Health Services, were able to work together and implement study-based fall prevention into their workflow, such as in electronic health records, and were able to assure that community-based programs such as Tai Chi were made available in the community to support that clinical linkage. Evaluation showed that older at-risk adults who received a fall plan of care had 40% lower odds of being hospitalized for a fall compared with at-risk older adults who did not receive a plan. Next slide, please. In Seminole County, Florida, an older adult falls needs assessment was conducted, and it was found that between 2006 and 2017, fall hospitalization rates had tripled and death rates had doubled. So Seminole County implemented the Senior Fall Prevention Program as part of an existing initiative, and a community health worker was able to travel through Seminole County with regularly scheduled stops to help meet the citizens of Seminole County where they are. Next slide. So this community health worker was able to assess those older adults in their homes for some of those risk factors that Yara was speaking about earlier. And based on these assessments, they were able to offer strategies or referrals to address these risks. CDC funded NACHO to provide evaluation technical assistance and ultimately helped Seminole County receive funds to continue this program. Next slide. I believe that brings me to the end of our presentation. We really appreciate you all having us speak, and thank you to everyone who has joined. I think we have some time for questions now.
We do. Thank you all so much for the presentation. My mom had 2 falls in the last few years and didn't really recover from the last one. So I really appreciate all of the work that you all are doing. Karan, you want to take down the slide deck, great, so we can kind of see each other here. So the first question that I will pose that came from our audience is, are the fall prevention goals going to be assessed by healthcare practitioners throughout the US or just in specific states?
We make everything open to everybody in every state. We've worked specifically in a few states with healthcare systems, but it's been mostly based on their interests. So for example, like Maine Health has reached out to us and we're working with them to give them technical assistance. We are going to start funding ASTHO, the Association of State and Territorial Health Officials, to work with 2 states, public health departments, to have them work with clinical systems and the community to try to put together holistic older adult health. And I don't feel like I've completely answered it. It's just all of our materials, our technical assistance is available to anyone who asks for it. And we are continually looking for ways to make healthcare providers, older adults and caregivers, and state public health departments and tribes aware of our resources, and that we're here to help them implement older adult fall prevention.
Great, thank you, Gwen. Appreciate that. Kathleen.
Yeah, thanks for the presentation. I would say that here, this is Kathleen Camp, and I'm at the University of North Texas Health Science Center in Fort Worth, Texas. And, we've done quite a bit of adoption and utilization of the CDC toolkit, both within our geriatric practice as well as in our community, doing fall risk screening. And we've even integrated it into our local EMS services. So we actually have 911 responders and their mobile integrated health care team utilizing the resources as well. So I'm just curious, because I've also integrated it into some of our interprofessional education programs for our students that are going through the medical program, PT, PA, et cetera. And one of the things that we encouraged our physical therapists to do as well was to take the CDC training course online for this certification. Do you know, is that something that y'all sponsored to be able to have that available? Do you anticipate that that will be ongoing? Or do you know much about that?
Our online training for STEADY?
Yes.
Yes, that is something we maintain, and it should be available always. It allows healthcare professionals to get continuing education credits for STEADY training.
Okay. All right. I
And-
didn't know if that was part of a sort of a grant funding that was for a short period of time, or if that was going to be
no,
ongoing.
that's something we're keeping continuously. And I'd actually thank you so much for using STEADY so extensively. And we'd probably like to follow up and talk to you sometime about how you're using it so that we can learn from you.
Sure. No, would love to share. And definitely that's just the tip of the iceberg. We have our students that are going through geriatric rotation engaging with it as well. So it's been great. It's been supportive.
Thanks.
That's really encouraging. Thank you, Kathleen. Appreciate all that work. There was another question in the chat. There are several available evidence-based falls prevention programs listed on the NCOA website. Could CDC include a link to those programs on the CDC website? Or maybe you already do. I don't know.
I'm not sure that we do, and I'm actually not sure that we can link to things outside of CDC. Where we are linking to the National Council on Aging is on the fall risk screener, which of course is on their website, so that wouldn't be surprising. But also in the Life Fall Prevention Planning tool, we're going to have links out to NCOA material.
Great. Thank you so much.
Thanks.
So I wanted to ask a question as well. Just based on my personal experience, when you go in and you try and do some of the, address some of those modifiable risk factors, like removing the throw rugs and those kinds of things, sometimes there is just a pushback from the older adult, right? They don't want things. My mother did not want anything to change in the home. And so I'm wondering if there are strategies within the CDC toolkits or resources, or if others of you have engaged in some of these kind of emotional battles that we have with older adults from time to time.
And Yara, did you want to answer that? Because you actually presented this part, or I didn't mean to take over answering the questions.
So we have some information about motivational interviewing and how to address, hesitancy from the patient side, but our materials highlight the risk factors that are within the home. So, the hazards that are within the home with a recommendation to remove them or address them. I would actually pose it to others that have experience with the clinical aspect. Our recommendation is to involve an occupational therapist once you identify those hazards. And I see Dr. Camp with her hand up.
Well, again, I tickle and laugh because yes, that's a very common issue and problem as well. They get very attached to those throw rugs and things of that sort. I will say also, as a matter of balance coach, because we delivered that program here as well. I think it really has to do, and I'm glad the point was brought up about sort of the motivational interviewing steps, right? You have to see where they're really at and that level of acceptance, but a matter of balance does have that as one of their topics of conversation about identifying, the issues and then, taking the initiative to talk about action steps. So I do think it has to come from them and not necessarily a daughter saying, Mom, you need to throw these out. Yeah. Mom, this is an issue. So I think that they have to accept that it's an issue. So yeah, it's all about approach, but that's a very good additional suggestion of maybe, again, resources to help guide that conversation and change.
Great. Thank you so much.
Also
ahead.
hoping our fall prevention planning tool will help a little bit with that, because the older adult can go in and read about things and make their own, check off items to make their own plan. And hopefully maybe getting some of that education about home modification and letting them make the decision would be helpful.
Right, and that's always important when you're working with older adults, is to ensure that they are part of that decision-making process. So it's super important. Here's a question for Gwen from Christy Fuller from the Georgia Health Policy Center. Does the Medicare annual wellness visit have a prompt that connects to the screening resources?
No, it does not. And we are trying to work more closely with CMS to see how we could incentivize healthcare providers maybe more to do fall prevention or get our resources incorporated. We're starting a project with the American Geriatric Society this year because of the new fall prevention world fall prevention guidelines that came out at the end of 2022, to see how maybe we could make our steady resources fit practice better, and what ways we could incentivize healthcare providers to do this. Thanks.
Great, that's
Yeah.
really helpful.
And I'll just jump, piggyback on that a little bit. We did talk to CMS about possibly including information about the falls free checkup into the Medicare, that's not a brochure, but the Medicare annual publication that they put out in the new resources section. So we've been working with CMS a little bit on that.
Great, thank you, Daniel and Gwen. Other questions? This is I do want to commend the new ASTO resource, the guide on community clinical linkages. I had a chance to review it and just found it extremely helpful. So I think that is definitely a resource that the link will be in the slides when we send them out. But you can also just go on the ASTO website and Google it and it will come up. So highly recommend that. All right, well, Daniel, Gwen, Yara, and Bailey, thank you all so much for this wonderful information. Always great to have you present as part of our monthly training series. If there are no more questions, I will turn this back to Karan, who has a couple of final messages for our audience.
Megan, it looks like one more question did come through in the chat.
Okay. Oh, here it is. Will the CDC come out with falls prevention during the winter months?
Probably not specific to winter months. We really have to base our advice on what there is evidence for. And while there is some talk in the literature about falls increasing during the winter, we don't really have good evidence for what effective strategies are for that. I think there may be one article from maybe a Scandinavian country about putting those little things on your shoes to walk better. But I don't think we've seen sufficient high quality studies to really advise us of what to do during the winter.
Okay, great. Thank you, Gwen. All right, Karan.
All right, thank you, everyone. Great session. I always like when there's great questions at the end as well. Just a few things to wrap us up. Firstly, if you did not know, we have a podcast that we launched a few months ago, and our second episode will be coming very soon. So stay tuned for that. It will be located at the same URL if you're interested in finding out more information about our podcast, and staying tuned for you can listen to the first episode, and then when the second episode, it'll be located at the link here. So feel free to use your phone, navigate to the page, and you'll be able to listen to our first episode and soon our second episode. Our next training will be on November 16th at 3 p.m. We will have speakers from the Public Health Communications Collaborative with us during that time. Registration will be under events on our website, afphs.org. And I put this information in the chat, but I also want to note that if you are attending this training and you are pursuing champion designation, please pause for a minute and mark that you've attended the training. Also, if you're viewing the recording of this training, please pause the video now and either use the QR code or the web address listed to mark that you have attended this training, so we can count this towards your 6 trainings to becoming an age-friendly public health systems champion. And with that, thank you all for attending today.
Thanks, everyone. See you next month.